In this quick video, we're going to talk about the Welcome to Medicare preventative visit. My name is Jamie from insurerrates.com. I want to welcome you back here to our YouTube channel. We're going to dive into this video and talk about what is this Welcome to Medicare preventative visit. Right off the bat, at the very beginning of this video, let me just say that it is not an annual physical. So you need to know that right away. Looking at the Medicare website, I'll leave links to both of the pages that we're going to look at in this video so you can check them out for yourself. But I've pulled it up here on the screen in front of you from Medicare.gov. So it says here that the Welcome to Medicare preventative visit is once within the first 12 months you have Part B. So Medicare Part B, which is your outpatient or doctor coverage, is the start date of that is very important because a lot of different things happen. Your Medicare supplement open enrollment begins. That means for the first 6 months you can get into a Medicare supplement plan without having to go through any sort of medical underwriting. There's other things attached to that, and one of them is the Welcome to Medicare preventative visits. So as you can see here, it says your costs in original Medicare. So this would be is if you have just original Medicare, you're not using a Medicare Advantage plan. It says you pay nothing for the visit if your doctor or healthcare provider accepts Medicare assignment. The Medicare Part B deductible doesn't apply. However, you may have to pay coinsurance, and the Part B deductible may apply if your doctor or other healthcare provider performs additional tests or services during the same visit that Medicare doesn't cover under this preventative benefit. If Medicare doesn't cover the additional tests or services, like a routine physical exam, see that there? You may have to pay the full amount. So it's important to go over this with your doctor and make sure that you are on the same page and that you know what your costs are, because otherwise it could end up costing you some money out of pocket. You don't want to do that. They have a little note here that says your doctor or other healthcare provider may recommend you get services more often than Medicare covers, or they may recommend services that Medicare doesn't cover. If this happens, you may have to pay some or all of the costs. Ask questions so you understand why your doctor is recommending certain services and if or how much Medicare will pay for them. So sometimes what you'll find is there's a little bit of confusion around this, and so this is why it's great to have a Medicare and You guide on hand. Most of them are downloadable now on the Medicare website. If you need a copy of the Medicare and You guide, you can certainly reach out to us. The link to our website is in the description of this video, or call our office and we'd be happy to email you a digital copy. So here's what they're going to go over with you at this Welcome to Medicare visit. Certain screenings, flu and pneumococcal shots, and referrals for other care if needed, height, weight, and blood pressure measurements, a calculation of your body mass index, a simple vision test, a review of your potential risk for depression and your level of safety, an offer to talk with you about creating advance directives. So anything that you might have related to long-term care, those types of things. A written plan letting you know which screening, shots, and other preventative services you need. Get details about coverage for screening, shots, and other preventative services. So when you make your appointment, you want to let your doctor's office know you would like to schedule, and this is what it's called, your Welcome to Medicare preventative visit. And then bring the following to your appointment: medical records, including immunization records, family health history, a list of any prescription drugs, over-the-counter drugs, vitamins, and supplements that you currently take, how often you take them, and why. And then just another quick note here: if you have a current prescription for opioids, your provider will review your potential risk factors for opioid use disorder, evaluate your severity of pain and current treatment plan, provide information on non-opioid treatment options, and may refer you to a specialist if appropriate. Your provider will also review your potential risk factors for substance use disorder like alcohol and tobacco use and refer you for treatment if needed. So this is the kind of the most important thing if you're wondering, okay, what is included or what's going to happen at the Welcome to Medicare visit. These 1, 2, 3, 4, 5, 6, 7 bullet points here is what you're going to look at together. Again, this is called the Welcome to Medicare Preventative Visit. If you're on original Medicare, you pay nothing for the visit if your doctor or other health care provider accepts assignment, and so it's just something to be aware of. Again, we'll put a link to this particular web page in the description of this video. If you have questions about Medicare, you can reach out to us toll free at 1-800-974-0552, or you can also learn more about who we are by visiting our website at insurerrates.com. If you enjoy videos about learning about Medicare, be sure to subscribe to our YouTube channel, like this video, share it with a friend, and if you have questions, you can also leave them in the comments below. Thanks so much for watching. Have a great day.